Hi guys, we good to go? Okay, well, good morning Queensland. Great news, 0 new community cases today. We have 3 overseas acquired cases that are in hotel quarantine, and I'll get Dr. Young to go through those in a moment. We've got 34 active cases and we had 11,284 tests overnight. So well done to Queenslanders for continuing to come out and get tested. And we did 20,811 vaccinations in Queensland Health vaccination hubs yesterday, which puts us at 69.27% first doses and 51.06 second doses. So that is fantastic. It's great that these numbers are starting to really creep up now, and we want to encourage every single person, no matter where you live in Queensland, to come out and get vaccinated. And that's why we're here at Deception Bay State High School today. And I'm here with Chris Whiting, the local member for Bancroft, because we want to encourage people to come out. And there is a number of high schools operating across Queensland today as a trial to see if people can come out and get vaccinated at their high schools. And as we hoped, there's a sausage sizzle going as well. So brings back memories of elections, doesn't it? Pop down to your local high school, get a sausage sizzle, support the school and get vaccinated. And I have 3 school students behind me now who have all been vaccinated. And they're a great role model for our community. If our high school students can be coming out and getting vaccinated, you can as well. So don't wait, let's keep our community safe and get vaccinated. Now don't forget, if you have any symptoms whatsoever, make sure you're getting tested as well. Also, I just want to comment, I've seen some reports in the last day or so around the Olympic Games. Can I say, I think there's probably a little bit of embarrassment on behalf of the Morrison government this morning. I think it was a misstep by Ted O'Brien making his comments, but I believe that's been righted now, and Ted O'Brien's now saying that Senator Colbeck will take it from here. Can I say, look, this was unnecessary commentary around the Olympics. The legislation that's been drafted is out for consultation. We worked very closely with the federal government and the Brisbane City Council in drafting that legislation. And of course, we've been consulting with them since, and as recent as this week, Ted O'Brien spoke with our Sports Minister, Minister Hinchliffe, and didn't raise any concerns, and Commonwealth officials said they were actually quite happy with the provisions that are being talked about in the moment. So I think it's disappointing, it's unfortunate, but we can move on now and concentrate on planning for a fantastic Olympic Games for Brisbane, Queensland and Australia. And of course, most importantly, our priority right now is getting everyone vaccinated so that we can open up our economy and keep everyone safe. I'll hand over to Dr. Young now.
Thank you, Minister. So good morning. So very good news, no locally acquired cases, 3 cases acquired overseas. So 2 of those people recently returned from Papua New Guinea, and the cases were detected in hotel quarantine in Brisbane. The 3rd case is a mariner on a ship up off the far northern part of Queensland, off Cape York. So he'll be assessed as to whether or not we need to bring him off that ship or whether he can continue to be managed on the ship. The ship left Indonesia 7 days ago, so we'll just work through with all of the mariners on that ship. So excellent news in terms of vaccination numbers, and I'm delighted, absolutely delighted to be here at Deception Bay State High School this morning. The sausages smell fantastic, and I didn't get to have breakfast this morning, so I'm looking forward to having one. So we're going to look at this and see if this works going forward. If it does this weekend, then we'll look at increasing other high schools and getting them involved. So please have a look out where you can go and get vaccinated this weekend. We know we've got a lot of people coming forward for their 2nd doses, which is fantastic because we had that super weekend 3 weekends ago. So please, if you had your 1st dose 3 weekends ago, come and have your 2nd dose this weekend. Anyone who hasn't had a 1st dose, now is genuinely the time to come and get vaccinated. If you're 12 years of age or older, because we've done really well due to a tremendous amount of excellent work in not having spread from our last incursion, but we just don't know when the next one's going to happen. And the thing that will protect us all the best and the most is to be vaccinated and to be fully vaccinated. So remember, it takes 5 to 6 weeks before you get full coverage, full protection from the vaccine. So you need 1 dose, 3 weeks later with Pfizer or 4 weeks later with Moderna, you need a second dose, and then you need an additional 2 weeks. So come out this weekend, a lovely weekend, school's back, so just take the time, come out and get that first or that second dose. Thank you.
Thank you. Welcome to Deception Bay. It's a place that I'm proud to call my hometown. It's a place of proud people, and it's a place where we work collaboratively and we work together. And I want to see that approach taken to vaccination. I want to see locals encouraging their family, their friends and neighbours to come down to their local school and get vaccinated. And I want to see students like Riley, Mary and Casey behind me encouraging their family and friends who haven't been vaccinated to come down to the local school here to get vaccinated. And what I want to say is it is the right thing to do to look after the ones you love. Show your pride, get everyone vaccinated.
Thanks, Chris. Well, good morning, Queensland. It's a beautiful day down here at Deception Bay State High School. It's Super Pfizer Weekend 2.0, so come on down and get vaccinated, and while you're at it, get a snag.
I just want to say that I'm so glad that our school has given the opportunity for the people in Moreton Bay to come get their jabs and that they can be COVID safe in the future.
So encourage your family, loved ones to come and get vaccinated so that we can get back to our new normal.
Minister, what's your level of disappointment with these three boneheads from New South Wales that crossed the border and went to the NRL Grand Final? How did they get across?
So I'm still getting the details on this, but it is extremely disappointing because it doesn't matter who you are. If you are sneaking across our borders, you are putting our community at risk, and it doesn't matter the reason why you're coming over. If you haven't got a lawful border pass and travel declaration to come, you should not be crossing the border. And anyone, again, doesn't matter who you are, will get fined and will have the police investigating. It's just appalling. It's really disappointing that it's happened.
Do we know exactly how they did it? I mean, the reports are, and speaking with New South Wales Police as well, they seem to think that there's been some type of fraudulent way to filled out the documents.
Look, what I'm aware is that they may have been travelling on an F-pass, and that may not have been a valid pass for them to have. So, you know, the police will investigate. I understand they may have already issued fines. I think it's appalling, not just sneaking across the border, but potentially, you know, making false statements in documents as well, which is a pretty serious matter.
And considering they went to that fantastic event that we had
Yeah.
in Queensland, would you like to see in the future, Minister, maybe a couple of nights in the cells for people that do this, rather than just that heavy fine? Is that a bigger deterrent?
Oh, look, what should be a deterrent is the fact that over 400 people have died since the 16th of June in New South Wales alone. Over 60,000 positive cases in one state from one person. If that's not enough of a deterrent, that you are putting every person at risk by travelling across that border, and you think about, you know, the irresponsibility of walking into a stadium knowing you've come from a hotspot and putting everyone at risk. I am extremely disappointed, and I hope it sends a clear message to other people that this is not acceptable. You know, doesn't matter what fine we give you, I think the public will judge you for that behaviour.
Have they been tested, do you know, and are they negative?
I believe they're negative. I can check that, but yes, they are.
Minister, there's essentially a tent city forming up in Moorland for stuck Queenslanders who can't get home. A lot of them say they're vaccinated fully. Why can freight drivers cross the border if they're fully vaccinated, but Queenslanders can't?
Well, we announced this week, if you are a Queensland resident who has already applied to return to Queensland or sought an exemption to come to Queensland and you're a Queensland resident, if you meet the criteria, we are going to be allowing up to 1,000 people on top of our hotel quarantine capacity to home quarantine. Now, we haven't hit that 1,000 yet, so if you do meet all that criteria, you are fully vaccinated, it's been at least 2 weeks since you've had your second dose, that you can show that you've had a negative test within 72 hours, that you can show that you've got a residence that you can quarantine in, that is a standalone residence, and that either you can quarantine alone, or if there's other people in that household that they're going to quarantine for 14 days, and you agree to all of the testing and the check-in system we've got in place, then those people may very well find themselves being able to cross the border soon. But there is a criteria. And we've said this because we need to make sure we manage this virus and make sure that we keep our community safe.
Minister, a Gold Coast GP was forced to close her vaccine clinic this week due to low demand. Are you disappointed in that?
Yeah, look, I'm a bit surprised. I don't know if that GP is stocking Pfizer or not, or just AstraZeneca. We know we've seen a decline in the uptake of AstraZeneca because a lot of people over the age of 60 have already got their vaccine, and we're really targeting those people under 60. Of course, if you're over 60 and you haven't got your vaccine yet, you need to come out and get that as soon as possible. But I am surprised because we're having GPs reach out to Queensland Health and say they're running short in supply in some areas, and where we can, we're helping them out until they get their next arrival. But all I ask of people is check if your GP is vaccinating. If you haven't had a vaccine, you can go to a GP, community pharmacy, or a Queensland Health community hub. We can't do this alone. We need all of us to be providing this vaccine.
Minister, you touched yesterday on that 70% threshold late November. Can I ask what the significance of a 70% threshold in Queensland is? We know that we talk about the 80% a lot. What's the significance of the 70%?
Oh, look, I mentioned 70 because I guess it's the first target everyone wants to get to. I want to get well beyond 80. We do that with our children. We have over 95% of our children in Queensland are immunised. So that says to me that families are willing to get vaccinated and understand the importance of vaccination. So there's no reason why we can't get well beyond 80%, and we're starting to see that in some pockets across Queensland. But 70% is just the first target. We want Queenslanders to, reach for the top, prove that we can get the highest number of vaccinations across the country. But as Dr. Young said, for those people who have been sitting back and going, we don't have an outbreak yet, I can afford to wait, time is up. It's going to be 5 to 6 weeks before people are fully protected if they get vaccinated today. We don't know what 5 or 6 weeks are going to look like in November. We don't know with the virus still in New South Wales, ACT and Victoria. We don't know what's coming, but we do know the virus will eventually come here and it will spread through our communities. So please get vaccinated now.
Sorry, Minister. Spoken to a woman prior to COVID who went to Redlands Hospital with appendicitis. She experienced a lengthy delay, had to be transferred to another hospital. It was up to 19 hours before she was actually seen to. The question is, how's the system going to cope when the virus is endemic, and will the government answer calls for more funding?
Well, the Commonwealth should answer the calls of the state health ministers for more funding, because we have been seeing year-on-year growth and demand in our hospital system. But the Commonwealth has not met the 50-50 agreement that was reached back in 2012. That stopped at 45% contribution by the Commonwealth. Commonwealth also capped it at 6.5%. So we want to see that levelled out. We're not talking about COVID funding, we're talking about normal funding of our health system, because those questions are about our normal health system, that there is significant growth, ageing population, less people taking up private health, people dropping out of private health, not enough aged care beds, not enough disability support. Every single one of those things are controlled by the Commonwealth but has an impact on our state hospitals. That's why we're asking the Commonwealth to partner with us and support us, because it's only going to get busier when we see COVID moving through our communities.
Minister, you touched on it. Do you reckon Ted O'Brien's in the naughty corner at the moment?
Oh, I think he is. I think Scott Morrison's probably feeling very embarrassed this morning that one of his government members came out attacking a draft bill, and I understand Ted has already sort of stepped back from that this morning and said Senator Colbeck's going to look after that. That's appropriate. and he is the Sports Minister, and I think we've been having conversations, but it is interesting. Ted O'Brien spoke with Minister Hinchliffe only this week and didn't raise any concerns, so it is a bit embarrassing for him.
Minister, what about the organising committee? Is there much on that at the moment? Do we know where that's at?
Well, look, the bill's got to go through first, so that's why it's out for consultation to look at what the structure of that committee will look like. And we work closely with 3 levels of government to develop that draft, and we'll continue to work not only with the 3 levels of government, but also with other key stakeholders in making sure that we get this legislation right, and then we can start the process of establishing the committee and going forward and preparing for the next 11 years to get to 2032 with the Olympics in Brisbane.
Minister, in April you acknowledged the need for cultural change within Queensland Health as part of a range of measures. What steps have you taken since then to change the culture?
Oh, well, look, we've been doing a lot of work, particularly around our First Nations changes and making tracks. We've been working tirelessly with Haylene Grogan, our Deputy Director General, and our First Nations people across Queensland to embed changes of culture in how we engage with our First Nations people. That is really critical. It's not just about their quality of life and closing the gap, but it's also about making sure that we've got more First Nations people actually in our workforce as well. So there's been a lot of great work done there.
But that's not going to solve the overwhelming capacity issues that the hospitals are facing.
Oh, well, you talked about culture. If you're talking about capacity, I've talked tirelessly about capacity and what we need to do. There's no one quick fix when it comes to demand on a public health system. The fact is, because we have such a positive, strong public health system in this country, people are willing to come in droves for public health, even if they have private health cover. And we need to work with the Commonwealth to help us deal with this demand, because as we open up as a country, as we open domestic borders, there'll be more and more pressure on our hospital system with positive COVID patients. And we need the Commonwealth to work with us to come up with a better funding model going forward to make sure the health system is sustainable, but also to give us urgent relief. And I noticed that there's talk about bringing health workers from overseas, and I welcome that acknowledgement by the Commonwealth. What that says is the Commonwealth knows that we have significant demand and there's something that's got to be done with it, but it can't be just about the workforce, it's got to be extra funding as well.
Spoke on funding from the Commonwealth. Paul Fletcher's accused the Palaszczuk government of refusing a $50 billion payment to Brisbane Metro. Surely for such a big project, a bit of extra cash.
Look, my understanding is because they'll double hit us on GST on that one. So I think Paul Fletcher should be honest about the funding around that. But we're building Cross River Rail. That's what our focus is. Cross River Rail is what's going to take pressure off the entire southeast Queensland rail network, not just the Metro rail system that the Brisbane City Council is proposing. We are funding that fully by the Queensland taxpayers. The Commonwealth has not stepped up and supported Cross River Rail at all. So I don't think Paul Fletcher is in a position to criticise whether the state is contributing to or accepting funds when it comes to Metro Rail when they're doing absolutely nothing with Cross River Rail, which is going to be so crucial for the Olympics come 2032.
Dr Young, just with back on these cases, the PNG workers, they're mine workers? Is that
No,
correct?
no,
sorry.
no. They went
ship,
into.
Do we know the ship's name?
Yes, if I could get my notes.
Yeah, no.
Sorry, I can't remember all of these ships. Right, so the ship is the MV Beltagur, and it's right off the tip of Queensland at the moment. So we'll just work through, and it arrived from Indonesia 7 days ago.
We know the variant?
Oh, it'll be Delta. That's all we've seen in a long, long time. But I haven't got that genome sequence back yet. I'll get that back by tomorrow. And the 2 individuals came on different flights from PNG on the 6th of October and went into hotel quarantine. But no, they're not related to mines.
And can I just ask Dr Young, I guess, your level of disappointment with those 3 that attended the football and I guess what could have happened?
Well, of course, I'm very disappointed. Our police in this state have done a fantastic job manning our borders, but they can't check every single person who's coming across to make sure that they haven't lied or misrepresented why they're coming across. So that is very, very disappointing. I'm glad that at least they've tested negative so they weren't a risk when they attended the grand final. But yes, it was very disappointing. And it's a problem. We know that just one case can lead to a whole series of consequences. So because of tremendous work by Queenslanders, we've managed to manage each outbreak. But we know going forward there'll be an outbreak that just spreads that we can't manage. We don't know which case that will be. We have to treat every single case rapidly, as we've always done. But I'm sure all of us would prefer not to have to go into a lockdown or to put restrictions back in place.
You said yesterday that those clusters are contained and that's why restrictions have eased. How do we keep doing this? And other colleagues around the nation perplexed at how we manage to sort of dodge Delta all the time?
I'm perplexed, but I'm really, really reassured that every single time Queenslanders just do what is asked. So they come out in droves and get tested. Even yesterday we had a large number of people coming forward to get tested. And I've always said it's about finding the first case in a cluster. And the only way we can do that is for people to come forward and get tested. People who wouldn't dream that they've got COVID, who just think, oh, I've got a cold, I better go and get tested, but haven't been near anyone or think that there's any reason they've got it. It's that reason, I think, that's made the biggest difference, that people are just prepared to come out and get tested, and then we find them. That 13-year-old who had a headache, I still can't believe that. She came forward, so we so quickly got on top of that cluster. Other people who just with no idea that they might have it, come forward and get tested. So I think that's probably one of the biggest differences in Queensland.
Dr. Young, forecasters this morning, medical professionals are saying that Victoria could get to 3,000 cases. That's not just going to be affecting Victoria, it's going to affect the nation, isn't it?
It means that we'll have to continue having requirements in place. Yeah.
Would you, in your right mind, ever have thought that 3,000 cases would be possible in Australia, like considering how well we've contained it?
It was always going to be possible. That's why we had to have such a strong response, because we know that the Delta variant in particular is very unforgiving. It will just get into a community and rapidly spread, and our only protection is vaccination.
Dr. Young, you've just recently returned from a trip to regional Queensland where we know vaccination rates are quite low. When you spoke to people there, did they tell you why necessarily they haven't come out and got vaccinated yet?
Very, very sensible reasons, that they haven't seen the virus in their community. So that they were just waiting and watching to see what's happening, and now they're coming out. Yesterday I saw large numbers coming out, so I've got no concern. I'm positive that they will hear that message. They are hearing the message.
Dr. Young, do you have tomato sauce with mustard?
I do. Of course I do.
What about you, Minister?
Tomato sauce and mustard, absolutely.
Beautiful. We won't hold you up then.
Thank you very much. Thank you for getting the message out.
Thank you.
And thank you.